Hey everybody, Dr. Jared Skowron from Spectrum Awakening. We are launching 5 new products, 5 new supplements today. These are things that you guys requested, so we went back and we worked with our producers and we're trying to make sure that we get you guys the best supplements, the highest quality stuff that's gonna help you, your kids, your family. We wanna be that for you guys. And of course, we want you to try everything that we've got. That's why we've got a 30-day money-back return policy. You try something, you don't like it, doesn't work well, it tastes bad, who cares, send it back, get a refund, all right? Because we want you guys to try all the good stuff. So what we're gonna do is kind of run through the new products that we have and show some research behind them. One of the things that a lot of people asked for were gummies. Gummies, gummies, gummies. My kid loves gummies. They're sweet, they're yummy. Who doesn't love a gummy? So we've added 3 new gummy supplements. Now, there are pros and cons to gummies, okay? Now, pro, they're sweet and sugary. Con, they're sugary, okay? But a gummy is what a gummy is. We all know it, but it's there. The other kind of downside to the gummy is that you cannot put a lot in there. So dosages are not high with gummies, all right? But in my opinion, it's better to get something than nothing. So if your child's not gonna take a supplement, a powder, a capsule, but they will take a gummy, better than nothing, all right? So let me talk about the 3 new gummy products we have. The first one is our vitamin D gummy, okay? So we've got, now we have 3 vitamin D supplements. So we have a chewable, so that's chewable Sunshine, which is cherry flavored and also has vitamin K in it. We also have it as a liquid, which is, you don't need much here, and it's in some safflower oil. I'm gonna need my cheaters for all of these, won't I? All right, and then of course we have our new vitamin D gummies. So these are our vitamin D gummies. And again, they are delicious. They come in, let's see, I think we got orange and red. So orange and red gummies, they're very good. And vitamin D, actually, you don't need many of these. Each gummy is 1,000 IUs. So you don't need a lot, which is great. Okay, I don't think I should chew them while I'm trying to talk. That's rude, isn't it? They're very sticky because they're gummies, but they're good. All right. Chew, 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 chew. We'll get it. All right, next, vitamin C. So a lot of people have asked for a vitamin C gummy. Vitamin C's are, vitamin C is wonderful, especially if you're needing to reduce histamine, if your child has allergies, if they have asthma, if they have eczema. I'm always recommending a vitamin C supplement. Now, vitamin C, some kids have problems because most vitamin C supplements are made of corn. So if you have a corn reaction, vitamin C is a little tough. And if you have a problem with oxalates, vitamin C could be tough because there is an oxalate issue. We'll get to the oxalates in a minute. So our vitamin C supplements, we have our histamine C capsules. We have our histamine C powder. I like those 2 a lot. We also have histamine C chewables. These are really big tablets, okay? So it takes a lot to chew them, but we have them. And now we've got our new histamine C gummies. Yay, more gummies, okay? And they even look like little, you can see them, they look like little baby oranges, which is cute. So again, if you're looking for gummies, now we got 2. We're gonna go for a 3rd gummy in our line. Let me just move everything over. The 3rd gummy in our line is an elderberry gummy. Now, elderberry gummies are very popular. We, of course, have an organic elderberry syrup, which is great. And now we've got the elderberry gummies. Again, they taste really yummy. They are gummies, but again, dose is an issue. So the dose of the gummy in the dose of elderberry in the gummy is 150 milligrams, but the dose of the elderberry in the liquid is 6,400 milligrams. So, I mean, so much more is gonna be in a liquid or a powder than a gummy. And that's just the nature of the beast, except for the vitamin D. The vitamin D gummies, you can get what you need in a gummy. So again, that's the pros and cons to gummies, but we wanna make sure that we've got options for you guys, for those kids who really love gummies and won't take anything else. We wanna make sure we've got them for. Quick question for Omri, what is elderberry for? Elderberry is an immune support. And we're gonna be going over some research just in a second. All right, so that's 3 new gummies we've got on our lines. The next 2 supplements are different and cool. The The fourth supplement is for oxalates. Okay, so many kids have a problem with oxalates. What are oxalates? Oxalates are a certain chemical that causes behavior problems. Now, that oxalates can be from certain foods. Those oxalates can be produced by intestinal yeast or intestinal, organisms that shouldn't be there, and the oxalates can cause a lot of behavioral problems. So it's tough to treat that. What you can do is A, go on a low oxalate diet, or B, bind your oxalates and flush them out, okay? So you bind them and flush them out with calcium. Calcium binds with oxalates and creates a calcium oxalate combination that gets flushed out, all right? Now, what's intriguing, and I'm gonna show you some research studies, the calcium oxalate tends to be a problem with those people who have kidney stones. But the oxalates in kids with the calcium don't seem to create the kidney stones, which is good. You don't want kidney stones, but that's maybe how you may have heard of the term calcium oxalate. It's a very common type of kidney stone. So you give the calcium, and what we have is a sweet tasting powder. So again, here's our new calcium powder supplement. We call it Oxalate Control, all right? And it's a calcium glycinate powder. Why I like glycinates for most of our minerals, 2 reasons. Number 1, it's very well absorbed. And number 2, it's very sweet tasting on its own. So this doesn't have any sugar in it, but it tastes sweet because the glycine has a sweet flavor. So I really like the glycine forms of minerals. That's what we try to have in the majority of our supplements. Because again, well absorbed, and you've got a good sweet taste. So Oxalate Control is a calcium powder that will help reduce oxalates and improve behaviors. Please note, calcium is constipating. So if you got a kid who's constipated, you'll want to put the calcium together with some magnesium. So we got our MagPow magnesium powder. We used to have a calcium magnesium together. We don't anymore, but we got them separate now. And that way you can adjust the different levels of calcium magnesium to kind of address your child's bowel movements, which is cool. I'd rather have them a little bit individualized, a little bit more work, but totally, individualized and adjustable for your kids' stools. All right. Last but not least, and the one that I am most excited about, is a supplement for parasites. All right, we've never had a parasite supplement on our website. I've been looking for one, and now I think I found one that we really, really like. And I love the name. I don't know who gave it this name, but you're going to get a prize. That is called Paraslayer. So whoever gave us the name Paraslayer, congratulations. What a great name. I love it. All the people at the factory were like, this is the best name ever. Why didn't we think of this? So Paraslayer is our new product for parasites. And let me tell you why I love this so much. Number 1, the best natural herb to kill parasites is called Artemisia. All right. It's also known as wormwood. And it has been used by the World Health Organization for parasites for a long, long time because it is so effective. So we've got the Artemisia in there, as well as other herbs that will kill the parasite, such as oregano, caprylic acid, anise, black walnut, and reishi mushroom, which is great, okay? Now, this does have black walnut, so if you have a nut allergy, you might want to be a little careful. It also has a probiotic in it. It's got lactobacillus in here. It's also got a prebiotic in here. And it also has a biofilm enzyme. So when we're using our other supplements for candida or for mold, hold on, I'm stretching to reach here on my desk, I will always combine together a biofilm enzyme with our herbs. This is an oregano, fennel, ginger combo in our No More Mr. Fungi. You've got the biofilm enzyme in here, and the herbs, and the probiotic, and the prebiotic. It's just an amazing combo, so I'm super happy that we found it. Downside, the flavor is horrible. Horrible. These are capsules. Only take these if you can swallow pills. If you can't swallow pills, please don't take these. I opened it up. I tasted it myself. It was gross. Tastes gross. Don't open the capsules up. But if you can swallow a capsule, man, this thing's got everything together, which is really, really cool. All right. So now, never mind me babbling. Let's take a look at some of the research. All right. So first, we've got a research study here, vitamin D and autism. Vitamin D and autism was found to have growing evidence for a relationship between vitamin D and kids with autism. All right, well, that's cool. vitamin D status in autism and the efficacy of vitamin D supplements. They did a research study where they gave kids some vitamin D up to about 5,000 IUs a day for 3 months, had significantly improved outcome, better behaviors, better stereotypy, better eye contact, and better attention span just with the vitamin D supplement. But again, dose matters with vitamin D. I see way too many people taking a low dose of vitamin D. So how much do you need? Well, this is a graph that talks about the RDA. That's the bare minimum you need to not get rickets, all right? And this is the tolerable upper limit, which is the amount that most people conservatively can take without harm. I think this tolerable upper limit should be much, much higher, but this is what it is. So take a look at these categories: children 1 to 3, children 4 to 8, children 9 to 70. That is not a typo, 70 years old. You're looking at upwards of 2,500, 3,000, and 4,000 a day, even though the bare minimum is 600. There's a lot of wiggle room between this 600 and the 4,000. So I highly encourage you guys, more is better in the majority of the time. With vitamin D, you can always test your levels after to see if you're going too high, but more vitamin D is better. The RDA is not sufficient. Even that research study, we're giving kids up to 5,000 IUs a day, 3 months, and got those benefits. Pretty cool. All right, next, let's talk about vitamin C. All right, vitamin C, wait a minute. These are research studies on the risk for scurvy in children with neurodevelopmental disorders. Most kids had a previous diagnosis, especially of autism, got scurvy more often than neurotypical kids. Why? Because the certain kids, as we know, have very restricted diets. If you've got kids that don't touch a fruit or vegetable and you don't give them a multi that has vitamin C, you can actually get scurvy. And there have been multiple case reports about this. So how do you know your kid might have vitamin C deficiency, which is scurvy? First off, you may see gum bleeding, mouth pain, or bleeding in general. Bleeding in general are things like nosebleeds or kids who bruise easily. Anytime I see somebody who has a lot of nosebleeds or a lot of bruising, I'm worried about a vitamin C deficiency. So if there are those symptoms or you've tested your vitamin C level, give some vitamin C or just give some vitamin C. Okay, it's not going to hurt anything. In fact, here we have another research study about natural antioxidants. Natural antioxidants may benefit with autism, mostly because they have anti-inflammatory activity. So things like vitamin E, vitamin C, and glutathione are going to help grab those oxidative molecules, oxidative atoms, and reducing ROS, which is basically rusting of the body and rusting of the brain. Here's another research study. Vitamin C, pediatric scurvy in a child with autism with a restricted diet. That child had a refusal to walk, had fatigue, a bruising rash, and gum bleeding. So again, that gum bleeding is one of the major signs for scurvy that you want to watch out for. But why I love vitamin C is because it reduces histamine. Histamine can cause hyperactivity. Histamine can cause sleep problems, okay? So it's okay to give some vitamin C, especially here. It's going to reduce histamine. It's going to improve asthma, eczema, and what's the other one? Allergies, okay? Why? Because it reduces histamine. This is a really cool study. It has nothing to do with autism. It has to do with histamine. This is the effect of vitamin C on histamine bronchial response. So what they did is they gave these people with lung problems inhaled histamine, okay? They inhaled histamine and all of a sudden their lungs started to have an allergic response. Because of the histamine, they had trouble breathing. So what they then did is gave 2 grams of vitamin C and repeated the lung tests and the breathing tests. And the breathing test called FEV1 was significantly improved and increased an hour after vitamin C treatment. And again, the vitamin C treatment was treating that histamine. So basically, you inhaled something that would cause a problem, and then they tested vitamin C to analyze if it would fix the problem. And it did. It lowered the histamine effect. So that's why I love vitamin C. All right, moving on to the elderberries. All right. The elderberry, which is called sambucus, here's the effect of sambucus on acute respiratory viral infections. And again, elderberry is a great herb for viruses, all right? And of course, what are we dealing with now? We're dealing with COVID. So there have been research studies looking at elderberry and COVID specifically, but there's been a lot of research studies on elderberry and viral infections in general. All right. So here we have exploring the potential effects of Sambucus or elderberry on COVID-19. It's known to reduce influenza-type symptoms, fever, headache, and also significant symptom reduction by an average of 50%. Pretty cool. Here's another one. COVID-19, is there evidence for use of herbal medicines as an adjunctive therapy? And again, this is an additional therapy, all right? If you get COVID, you do as much as you can. Don't just take elderberry and some vitamin D and vitamin C. Do as much as you can to stay healthy, all right? What's interesting about this one is they have 4 categories that they evaluated these things. The categories are either positive, which is the best, promising, negative, or unknown, all right? They looked at benefits and risks to different herbal medicines and found the positive, the best category, were in 5 different herbs, one of them being Sambucus. So, several herbal medicines have safety margins superior to those of reference drugs and enough levels of evidence to start clinical discussions about their use, not just with viruses in general, but with COVID. Okay? Again, we're not saying this is definitely going to help, but if you want to do as much as you can to kill viruses, elderberry is a great thing to do it. All right. Next is the oxalates, and then as soon as I'm done with this research, we'll round out with all the with the Q&A. This is a potential pathogenic role of oxalates in autism. Children with autism demonstrated 3-fold greater blood oxalate levels than neurotypical kids. However, all of the problems with the kidney stones with calcium oxalates aren't there in these kids. So what they're considering is that the oxalates may cross a blood-brain barrier and disturb central nervous function in the autistic children. So we want to remove these oxalates. How do we do it? Either a low oxalate diet or take some calcium supplement so that you can bind it up and move it along. Last but not least, research on our Paraslayer, especially that herb Artemisia, or the active ingredient in Artemisia, which is called artemisinin. I practiced saying that all morning. This is the research of artemisinin, and look at this date. This is 2004. Holy cow, this is 15 years ago. This is 17 years ago. This research is being produced that talks about how Artemisia has been shown to be a fast-acting, safe, and effective supplement, herbal, against many drug-resistant forms of this specific parasite. All right? Here's another one about Artemisia on its effect of other parasites and the parasite's host cells, and they found a significantly reduced number of parasites in their own eggs and within the cells that they've infected. Last but not least, excuse me, anti-parasite efficacy of traditional herbs, and they saw that Artemisia was effective in killing both the infective larvae 40 days and killing eggs within 20 days. Is a very promising treatment against certain parasites like this one, Ascaris. So I love Artemisia. I have for decades. It's a wonderful herb. Lots of research used by the World Health Organization to kill parasites. Problem is the taste, blah, like rainbow vomit. I wish I had one of those apps or thing, rainbow vomit with the Artemisia. But boy, if you can swallow the pills, it'll kick that thing